And we'd like to thank Desert Financial Credit Union for sponsoring the KRIM Community Spotlight Program. Good morning, Rim Country. Chris Higgins in the studio. Hope you're having a wonderful Wednesday morning. Beautiful weather out there. Still a little windy today, so those, sails that you might have up or other things in the yard, your umbrellas, you might want to put them down so they don't blow away. But thankfully, not as windy as some other places in northern Arizona, like up on the rim or in Snowflake. So still very thankful for the beautiful weather that we have here, and just thankful it's not cold anymore. So this morning in the studio we have Banner Payson Medical Center. We have CEO Hoyt Skabelund. Good morning, Hoyt.
Good morning. Thanks for having us.
Yes, and we have Dr. Strand, who I believe is new to Payson, aren't you?
Correct.
All right, welcome to Payson, and thank you so much for coming in this morning. And also Debbie Peafish, Senior Manager Practice, oh my gosh, I can't get it all.
I'm the practice manager of the specialty clinics for Banner.
Thank you.
Welcome. Good morning.
Good morning to all of you. So this morning we're going to be talking about, I believe, the new position that Dr. Strand is coming in to fill.
Yeah, we're super excited. We've been waiting for Jodi's arrival for several months, and it's a big deal to have someone of her caliber come to join our oncology program, to join Dr. Abarish, who's been providing support for our oncology patients in Debbie's clinic from using telehealth. It's kind of an interesting concept to preserve our oncology program until we could bring Jodi to come and help us. And Jodi is a doctor and nurse practitioner. I'll let her talk about that and differentiate. And either way, she's got lots of experience. We're excited about a growth opportunity to serve more patients locally and to provide a choice for patients who may be driving to the valley for their chemotherapy care and their cancer care. Our hope is to take that stress away and allow them to receive care close to home.
Well, that sounds like a great option and a great thing. So Dr. Strand, tell us a little bit about yourself.
Originally from Minnesota and moved to Arizona the first time about 20 years ago.
Mm-hmm.
Really enjoyed it, lived here for 16 years, and then I got recruited to a small rural oncology clinic in Oregon, on the Oregon coast. So I've spent the last 4 years doing rural oncology treatment in Oregon, and time to move back for family and the beauty of
Arizona. Oh, I know, it is a gorgeous state. So how, what was the population of the community that you were in Oregon?
There were two towns that was kind of like Gilbert, you know. They were about 30,000 together.
Oh,
so
okay.
15,000 was the town that I was actually in, but they were kind of like Minneapolis, St. Paul together. And
gotcha, like a twin city.
Yeah, like a Twin Cities type of thing. So about 30,000.
Yeah. much smaller than the Twin Cities. So about the size of Payson, 15,000.
Yeah,
a little smaller.
Yeah, a little bit. And then we serviced the entire southwest coast of Oregon, all the way to the California border, and then about an hour north of us, so about 5 hours north of the California border.
Mm-hmm.
And we were the oncology clinic in that area.
So it sounds like you enjoy serving and living in small rural communities?
Rural is the way to go. Yeah.
There we go. So that is true, and I think that plays a big part probably in recruiting, doesn't it, and hiring Hoyt?
You know, I always am nervous. Debbie's a big part of our recruiting in the specialty area. And one of my concerns always is, has this provider ever lived rurally? Because if they haven't, they and their family may think they'll enjoy it, but if they don't have a Kohl's within 500 drive, you know, they may not enjoy it, and that it's not for everyone. And so to find someone like Jodi, to learn that she was driving distances and was a backbone provider supporting an oncologist in that setting, we began to drool with excitement to hear that she had a connection and family in the valley and was familiar with Payson and loved the mountains and the trees and the forest. It was an answer to prayer, literally, is what I would say. we have an oncologist in our program, and we had Dr. Larry Casper for 30 years coming to Payson once a week, and then he's retired, and he retired from coming to Payson a year and a half ago-ish.
Yeah, a little over a year and a half ago, yeah.
And then we had to find a doctor, an oncologist, who was Dr. O'Neill, who is called a locum tenens. A locum tenens is a temporary physician who comes and fills a need on a temporary basis. So he did that for a year, which we were fortunate to find. There's a shortage of oncologists in the nation today. And so it's very challenging to recruit, especially a part-time oncologist. So Dr. O'Neill was replaced by Banner's Dr. Abarish. Dr. Abarish is an amazing oncologist, and I've known him for 5 years. He lives in Warland, Wyoming. But he has children in Denver, Colorado, and so he drives to Denver every other week. And Debbie and her boss asked if would he consider flying to Phoenix and driving up to Payson, and then using telehealth in between to take care of our patients while we looked for a Jodi Strand. And he agreed. And Dr. Abarish is an amazing individual, cares deeply about his patients. He's highly skilled. He's excited that Jodi's come as a nurse practitioner to join our practice, and so Jodi will be the boots on the ground. The patients will build their primary relationship with her. She and the patient will then get Dr. Abarish on the phone, so to speak, on a televideo screen, and Dr. Abarish will counsel with Jodi, and the two of them will design treatment plans and modify treatment plans and provide chemotherapy out of the hospital for these patients to keep them close to home. That's Hoyt's high-level summary. Jodi can correct the incorrections, any inaccuracies, and then she can also paint a fuller picture.
Yeah, so just want to mention, speaking of telemedicine, watching this morning and saying hi is Randy Roberson.
Hey,
he
Randy.
Said, "Yay, Banner! Hi, Hoyt!" And so Randy, very familiar with telemedicine. Even many years ago, working with telemedicine. So not concept, but how you will be operating, working with another doctor that will be utilizing telemedicine. Has that been something that you've done before in the previous position?
Yes.
You did. So is that becoming pretty common practice now in rural communities?
Well, it became common practice in every community during COVID.
Yes.
When we were all shut down for COVID, we gave the patients options for telemedicine, and that's when it really took off. But especially in a rural community, it's very important, and especially with oncology patients, because some of the side effects, they may not feel well enough to drive into the office, and if it's just a follow-up, then we can certainly do it well over telemedicine and save them the pain of driving.
So what led you into oncology?
Passion to help people.
Okay.
I was started out just in a family practice, and then I had the opportunity to work with the GYN oncologist, gynecologic oncologist, and perform surgeries with him and do the whole, every aspect of it, and you either love it or you don't.
And it's interesting to me in the medical profession to find out what leads medical professionals, doctors, nurses into the area that they're working in.
Amen.
What draws them into that, because they're different. I guess sometimes you can look at the medical profession, it's medical. It's all medically related. Doctor's a doctor, a nurse, but that's so far from the truth. And you really have to have a passion for the field you're in to be able to day in and day out provide that service for your patients.
Debbie works with all of our specialists, and I'm curious what your thoughts are, if you agree with Chris.
I do agree with that. Yes. Yeah, you have to have a special knack for those specific specialties. It all takes a different, I would say, personality, drive Each one of our providers is driven in a different way based on their specialty. And, and it's nice to see, it's good to see there are different aspects of why they did what they did.
Mm-hmm. Yeah, just from our programs and all of the different medical professionals that you have brought in and that have been guests on the program, going from ER and kind of what ER is like, and the people that enjoy that, and that is where their passion is, to physical therapy, to oncology, OBGYN. I mean,
you could almost in the industry, we sometimes will tease each other and stereotype, pediatrician, pediatrician, family medicine, internal medicine, oncology, ER surgeon. You're talking like a surgeon,
Yeah.
And so they all have a predisposition that fits well their specialty. I think oncology is one of the most unique, because in oncology, not every patient has a happy ending. And there are cancers that are not curable. We know that. There are cancers that we've made great advances with. And we'd make every attempt to extend life and quality of life. And so oncology practitioners, I feel I have great respect for, because there are ups and downs. And you have to have great perseverance. Love is a word I would use.
Yeah, absolutely.
Deep love. And be a scientist, because tenacious.
Yes.
We're going to find a way, and then to keep current with the science in oncology is always changing. So you have to be a ferocious reader. You have to be highly intelligent to retain all that information. True of all providers, but I think oncology is one that I have great respect for.
We get about 300 a week new medicines that the FDA is clinical trial information.
Wow.
So on the different types of cancer, and no cancer is treated the same, and it depends on genetics and a whole bunch of, looking at the very deepest cell as to why, trying to figure out why the patient developed the cancer in the first place. And then we have targeted therapy now that's really extending people's lives and helping, cure cancer, but not there yet.
Yes, and it was good to point out, because when people are going through cancer treatments, usually those treatments are really breaking down, the body, and as far as energy levels and immune system. So traveling, if you can avoid having to travel down to the valley for treatments, that is really big. And so I'm sure that's a big advantage to people that are undergoing treatment, to be able to have the services here in Payson.
Very excited to be here.
It's going to make a difference. This is an area that we feel, as we look at strategically, how can we serve the community more fully? We're not able to do heart surgeries. We won't ever be able to. You have to have a population of 250,000 typically before you'll touch that, and that's 10 times our size. We're not going to do brain surgery. There's just certain things that we're not going to do, and it's cost prohibitive, or there aren't enough specialists. But oncology is something that we do, and we feel this is a place to place focus. And so we've invested in Jodi coming. We're hoping she'll live out the remainder of her long career here, but with her, and coupled with Dr. Outreach, our amazing chemotherapy team, they're more excited than Debbie and I about Jodi's arrival. In the hallway, they've been doing the countdown. It's like Christmas. She arrives, 2.5, and then they were teasing me, 2 days, 53 hours, or 53 minutes and X seconds, So we have chemotherapy certified nurses. Our pharmacy team that is highly trained to mix chemotherapy. This is a very complicated, exact part of healthcare that we're proud to be part of, and to add Jodi to be a connector with the patients, and to be she'll make most of the decisions surrounding their care within published guidelines, and then she and Dr. Outreach will counsel together, and you have the minds of two.
Yes.
Doing a Vulcan mind meld for those Star Trek fans out there. And you get to double the knowledge, and a these 300 medicines that come out constantly, there's two minds on that, and the joint knowledge. We're excited about it.
Well, again, if you're just tuning in, talking with Hoyt Skabelund, CEO of Banner Payson Medical Center, and new arrival, Dr. Jodi Strand, new oncology services provider here at Banner Payson Medical Center, and Debbie Peatfish. And telemedicine, I just, if we can talk a little bit more about that, because it is playing such a large role, I feel, or significant role, but significant role, and having a significant impact in the level of services and the services that Banner Payson Medical Center can provide, and to the extent that they're provided, because in this situation, it's kind of going to be like a dual approach, where Dr. Strand, boots on the ground, like you said, and then the other doctor providing support through telemedicine. Are there other, I'm trying to think, other departments that are like that? And I believe
well, the place where we have used telehealth for decades. This will sound really basic, but it's the same technology in essence is teleradiology.
Mm.
There are not enough radiologists that you can have every film read on site, and so the industry decades ago, and sending those images in a way that they were clear picture, and having a radiologist interpreting, dictating, having those notes typed, sent to the chart. That was in the 80s, and so 4 decades. And then the next part of the industry that began to take full advantage was telestroke. So time is everything when a stroke patient is diagnosed. And so, but you cannot have a neurologist in every hospital in the country. There aren't enough. So in emergency departments, we've been using telestroke for several decades. I don't know, we'll say 3 decades.
Yeah, about.
Wow.
And that's where they could see the patient, be looking at the eyes and the pupils, are they dilated, and the nursing and the ER physician counseling with the neurologist. The third area that then, in my opinion, that became the next to move forward was behavioral health, telepsych.
Okay.
So psychiatry, patients in the emergency department who are at risk of harming themselves or others, and understanding how do we care for them, what medicines can we give them right now to help them settle. And so telepsychiatry's been, that's probably the last couple of decades.
Yeah.
Oncology, more recently, I would think.
More recently.
What are your thoughts?
Oncology, I guess the major thing was COVID that drove oncology to telemedicine, because we do need to put our hands on the patients and examine them, especially if a woman has breast cancer. We don't want to, you can't really do a full exam over telemedicine, but I guess it was COVID that really, and we'll see where the future goes on that. Someone with yearly follow-ups, or a blood disorder, those would be the type of people that would fit into the telemedicine continuing, I think.
I think in our hybrid, I call that word, here, our hybrid model is Jodi's a trained practitioner, and she can be the hands on the patient, and she can report to Dr. Abrish when needed, when we need his training as he's an oncologist, so he's trained. Maybe you could talk about your training. I think that'd be helpful, and then in comparison to Dr. Abrish with an oncologist, that would add context to the telemedicine discussion.
Yeah. Well, I'm licensed as a nurse practitioner, but I did go back to school and get my doctorate degree in nursing practice. I felt that the patients deserve that. That's the highest you can go as a nurse practitioner. So the medical, Dr. Abrish is a medical doctor, and he went through medical school, and I went through nursing school. I have about 9 years of education with everything. Wow. So I think he, 4 years of medical school, 4 years of specialty training, and then fellowship. And so we kind of...
Probably 12 years and 9 years, a lot of years, over 20 years of training between the two of them.
Wow.
So that's kind of, he's the, he will be the one that comes up with, well, we both will be, but the original plan will be from Dr. Albrecht and his extensive training, and I will see people for, prior to chemotherapy to make sure they're not, kind of control their side effects, make sure they're acceptable to perform the chemotherapy on them. And then if something changes in their, condition, I'll do the tests and consult with Dr. Albrecht. And it'll be a complete team approach to every patient.
With Jodi doing 90% of the patient interaction, which I think is what this hybrid model strength is. We love her. Her demeanor. She's the pharmacists love her. The nursing staff. She left a wake of excitement when she interviewed, and so the patients, anyone that's listening, you have family, or you in the next coming years, we hope you won't see cancer in your family, but chances are in our country you will. If they live in the RIM country, this would be my first stop to come in, meet with Jodi, Dr. Albrecht, and see what treatments are available, and we'll refer you to the Valley when we can't offer you the treatment that you need. And so Banner MD Anderson is our oncology center in the Valley. So you won't be passing up anything by coming to see us. We'll be connected to send you when that's in your best interest. But if the treatment that is indicated for you, it can be done here, we can save you a lot of time and stress. And when you're immunodepressed and at risk, anything we can do to preserve your energy levels and avoid unnecessary travel and stress, especially for our elderly. Many times they tell me that it stresses them to go and drive in the Valley. So if we can keep them off the roads, that's great, and truly excited about it.
Yeah, I don't think it's just the elderly. I think when you're so used to driving here in Payson, and you're not dealing with traffic, you're not dealing with real aggressive drivers, the freeways. So you go down there, and
it's good for all of us.
Yes.
And then to having my sister had breast cancer, she's a survivor, thankfully, and my brother is a survivor of cancer. I may likely by genetic disposition have cancer before my life is done, and I've had cousins who've died of cancer, and so I'm very familiar with the stress and the emotion that goes with to be able to go to work and not have to take a whole day off to accompany family to chemotherapy is a tremendous advantage to have chemotherapy locally, and we've been delivering chemotherapy for many years in Payson, and we hope to grow this program to where we could reopen our radiation oncology program. And I think that may be part of the vision that Jodi intrigued her to come, is she's a pioneer. She and Dr. Albrecht and our ATU staff, Debbie, and her amazing team. Maybe you could tell us a little bit about your clinic. Where's the clinic? Where will Jodi be practicing? Where does oncology take place?
Jodi is joining our Payson General Surgery practice. It's our multi-specialty practice. We have cardiology there as well as the oncology. We have an amazing team there. Very experienced MAs. Very experienced front office referral staff. That's at 122 East Main Street, so just right across the street here. It's a great practice.
Good team.
It's a great team.
The team takes good care of our oncology patients, and I need to do a shout out. I was vacuuming some rugs in the front lobby of the hospital the other day because we get that crushed granite, and it's just a constant. It's not fair to ask the EVS team to they can't possibly keep it vacuumed all the time. So I like to swing the vacuum. I used to be a custodian. And in walks a member of our community who it turns out was a member of the quilting club with a pile of blankets to where I could hardly see her forehead walking in. And I learned that the quilting club in Payson, the RIM country, donates these blankets, these quilts, that the cost of the material and the hours and hours and hours of time quilting, they're beautiful, comes and brings them to the hospital for our oncology patients.
Wow.
And our oncology patients love these. So when you're in chemotherapy, you might sit in that chair for 4 hours, 6 hours, 2 hours. So you get to stay warm with your blanket, and you take it home with you, and it becomes a keepsake. And so to those who are part of the quilting club, I know I'm not saying the proper name, We are grateful.
The Rim Country Quilters.
Is it the boat?
I believe so.
Is that who the name is?
So,
So
yeah.
we're grateful for the donated quilts to our
Wow.
patients.
Well, I'd like to say thank you to them also.
Yeah.
That's a huge
Mhm.
plus for our patients.
Oh, yes, showing that support.
Well, chemotherapy makes you feel very cold too
Mhm.
when it's
Mhm.
infusing, so
Mhm.
it's a comfort.
Mhm.
So thank you.
And you were talking about the kind of in the future, the radiation bringing the
50%, roughly 50% of patients that require, oncology patients that require
Mhm.
chemotherapy also may require radiation oncology. That was offered in Payson years ago, and then that was closed. The practice closed about 4 or 5 years ago. It's very expensive. The linear accelerator is what delivers the radiation through essentially a laser, and to a very precise place. They can even be an inch below the surface, and it's fascinating. But those cost about $3 million, and then a building to put it in, etc. So I'm hoping that in the next 3 to 4 years that we will, as we grow our medical oncology business, that we'll get to a place where we could venture into radiation oncology, which would require a grant to be able to pay for, because we don't have the volume of patients that would make that $3 million investment pay off. But if I can get a couple $1 million of donated funding and grant funding, we could break even on the service. And Banner has told me that if we can grow the service, they would be supportive of operating the service at a break even.
Wow.
And that's rare, because there's always going to be some low months and some high months. But Banner is committed to doing that if we can find the funding and develop the funding. So first we got to grow the medical oncology program, the chemo program, and then I'm a big dreamer, and I love big, hairy, audacious goals. And one of my goals is to allow people to not have to travel or move into a camper trailer for 60 days for the radiation oncology treatment.
Wow, yeah, that would be huge.
I think that's all of our vision.
Yes.
Wow.
Great.
So everyone working towards that vision. That is.
And we have a foundation, and we already have $160,000 of a gift from a patient that we are designating to that. And so we have our first monies, and any of those that are passionate about cancer care, and there's estates that want to contribute in advance over the next number of years towards that goal, we would certainly welcome those gifts and honor them, and by trying to create the best oncology services with the greatest convenience for patients in Rim Country. And I will be one of those gifts. My wife and I will be donating towards that cause over time, so we invite others to join us.
There we go. Well, I look forward to hearing more about that, and as it progresses and as it gets closer, it'd be great to get updates on that.
You know, we won't be able to hold that in.
No.
As we're making progress, don't worry about that.
Yeah.
No. Oh, that is great. Well, it is 10:30, so thank you so much, Hoyt, for coming in today. Thank you, Dr. Strand.
Thank
Very
you.
nice meeting you, and thank you, Debbie.
Yeah. Thank you.
It was great having you, and great learning about the oncology program and everything that's happening, and yeah, the cables. They keep the little guy from chewing on the cables down here. Come on now. But again, thank you, and hope you have a wonderful rest of your week.
Thank you.
Thank you.
You as well.
Thank you, and big thanks to Desert Financial Credit Union for sponsoring our KRIM Community Spotlight program. Just really appreciate them and all they do for the community as well. Well, time to get back to the music here on KRIM with some Greg Almond, Pet Shop Boys, and others. But first, let's get a quick update from, stop chewing on the cables, from the National Weather Service. All right, nice to meet you. Little stinker, you. Little stinker, you get those cables. No.
Jeff, we should bring you back with other specialists. We need to talk to Jennifer if you want to think through which ones you think, who we're trying to market, who needs. If they're all busy, it's probably not good. But like if we bring Gomez, we bring Palmer.
Oh yeah, we will definitely.
Come with and get him on the program. We ought to get Dr. Aubrich, we ought to have him, Crystal Well by phone, so we get Dr.